Hi, I'm Beth Stapleton, Manager of Family and Community Partnerships for Harford County Public Schools. Welcome to the Parent Academy Real Talk, where we're sharing about a new mental health resource for our students, staff, and families. With me today is Mr. Buck Hennigan, who's our Executive Director of Student Services. Thanks for joining me today.
Thanks for having me.
And this is super exciting news for everyone in the district, this new resource. So talk to us a little bit about what families are going to be able to access, students and staff as well.
Sure. So the name of the organization is Care Solace, and we've been working for about 6 or 7 months trying to nail this down, and we finally were able to get the contract solidified this week. So basically the way Care Solace works is they take all the work out of finding a therapist, a psychiatrist, substance abuse counselor, or even inpatient mental health resources for students, for staff, and any family member of students or staff. And it can be accessed in a multitude of ways. And we're getting ready to kick off on June 1st.
Wow, this is wonderful news.
Yeah.
So I hear in my circle that in some cases it's very difficult to find a mental health therapist. It takes a lot of time to make the phone calls, to do all of the follow-up, and you know, when you're working throughout the day, it's difficult to take time to do that. So how would a staff member or a parent access this support?
Sure. Well, and to your point, there's an organization called the Health Resources and Services Administration, and they actually designate areas across the country as health professional shortage areas, or HCPS.
Yeah.
And Harford County is a HCPS.
Okay, so what we're experiencing is actually real, right?
Yes.
You really can't get the help you need when you need it.
Sure, there's data to support that we do not have the mental health resources in our county that we need. So that speaks to why parents or family members or staff members have a hard time finding a therapist and may give up. And really that's where Care Solace comes in, because Care Solace can be accessed through the website or phone number, but also our staff, like our school counselors, psychologists, social workers, administrators, can make referrals on behalf of families, and we're going to have a waiver where families will give permission to the school system to do that. Once that's done, then Care Solace takes over, and really they do all the work of trying to find a therapist, a psychiatrist, a substance abuse counselor for you, and we'll even set up the first appointment for you.
Wonderful. So thinking of the fact that we don't have as many mental health providers as we need, would there be a TeleMental Health option perhaps with some therapists, or is that really mostly in person that we'd be looking for?
No, there definitely is. I think during COVID a lot of therapists went to that telehealth model, and many have returned to in person. So it's really based on the patient and how they want to access their treatment. But the great thing is, so when you think about accessing mental health resources, again, you have to make those phone calls. You have to try to find the therapist that is in your network, that takes your insurance, that has availability for you. And that can take hours. And really, they estimate saving at least an hour to 2 hours per person of trying to find those resources. And having done that myself, it really could take forever, especially a psychiatrist. It's really hard to access. So what you're doing is giving them very basic information of who you are, what you're looking for. Do you want a certain gender or race in your therapist? How far are you willing to travel to that therapist? What your insurance is? And they take it from there and do all the work and then get back in touch with you, and we'll tell you that you have an appointment set up. So it's really, you can sit back and wait and have them do all the work, which is really amazing.
That is amazing. And thinking about, you know, our students, so it really is the adult that's going to be making the contact with Care Solace. This isn't a direct student. The students wouldn't be calling Care Solace. The adult in their life would be.
Sure, yeah, and again, it can happen several ways. So let's talk about students first. So if a parent gives permission to the school system to engage with Care Solace, the school staff member will put in the basic information, and then Care Solace will reach out to the parent. The great thing about that is all of our staff members in student services and our administrators will have a dashboard. So let's say I'm a school counselor and I've made 30 referrals. My dashboard will tell me where all those referrals are. So they may have, and they have a drop-down menu to show that this Care Solace reached out 35 times to this parent, or that they called them once, they already have their first appointment set up. So I can see all the referrals I've made and where they are in process. The other piece is that staff and students or families can access this themselves. So they could say, well, I'm going to take care of it, go in, put in very basic information, takes 2 to 3 minutes, and then Care Solace will reach out and call and begin to set up that process for them.
So do you have to have any kind of referral from anyone to say, yes, I need this care, right? So would you have had to seen anybody before you contact Care Solace to kind of have a screening or anything like that?
No, absolutely not. And
Okay.
again, Care Solace is not a mental, they do not provide therapy.
Right.
They are just the third party that will find it for you.
Okay.
And so really, honestly, families across the country access this service through school systems and make it just such an easy way to access resources. The really amazing thing about this and why we've been able to partner with the health department, and I want to be really thankful now and grateful to the health department because they are fully funding this for next school year.
Oh, that's wonderful. That's
100%,
great news. Wonderful
because
partner.
all of our students and all of our staff also can access Care Solace for any family member.
Okay, so talk us through that. What does that mean?
Yeah, maybe scenario-based, maybe.
Yeah.
Let's say, so I have a daughter going away to college next year.
Okay.
Let's say she goes away to college in California, and I'm thinking, I want to try to find her a therapist. How am I going to do this? I can go in, fill out 2-3 minute questionnaire for Care Solace. They will find her a therapist in California, in her area, that will help her. I have a mother that lives in New Jersey. I can go into Care Solace, put in a referral, they will find her a therapist in her town in New Jersey. So it's really for any staff member and any student's family. So let's say we have a student in our system who has a 30-year-old brother. They will access Care Solace, will access resources for that 30-year-old brother. So anybody in our system or anybody in our county that is a family member of a student or staff member really has access to Care Solace.
That's amazing.
It is amazing. It probably
That's really
covers most
great.
of our county.
Wow, that's
Really.
fabulous support. Very
is.
good to hear. Well, this is great news. And again, thank you to the health department for supporting us and funding us on this. And then thinking about what comes next. So we're sharing this information with families. How soon can they begin to access this resource?
Sure. So we're going to go live on June 1st.
Okay.
Between now and then, we'll have a series of press releases and letters that go home to families, letters that go home to staff, as well as this video to help people understand. Because what we don't want to do is lose the summer.
Right.
So starting June 1st up and through June 30th of next year, that's when our current contract exists, and hopefully we'll extend that contract. Families can access the service. So in the middle of the summer, if a family member wants to reach Care Solace or wants to reach out to the school to make a referral, they can do that. And the beautiful thing about the care companions at Care Solace is it's 24/7, 365.
Wow.
So any time of day, any day of the year,
Wow.
you can call it 3 a.m. on Christmas Eve.
That's great.
And someone will be available to pick up the phone and take your referral. But you also can go on the website and fill out the referral through the website as well. And Harford County Public Schools will have their own Care Solace website starting on June 1st.
Right, and so we can share the link with families as well, and I'm sure that'll be sent out. Wow, this is a great resource. Congratulations. I mean, this is
Thank
huge. I know we've got increasing needs around mental health. We talked about that before we started taping, and just seeing that, access 24/7 for all family members is going to be a huge help for families. So thank you for that.
You're welcome. Yeah, I mean, we have 43,000 staff and students, and then all of their family members.
That's
so
amazing.
this is going to be a game changer for us, and it's truly going to save the school staff who often do this work on behalf of students to try to find them somebody. It's going to save them a lot of work and a lot of time.
It's going to
as well.
save parents a lot of time.
Yes.
Myself, I hear you spend hours trying to find care. I mean, usually you're with a pediatrician and you might get a list of names and such, but this is really going to be a game changer.
Yes, and if I could add one thing, so we
Sure.
currently have EAP through our school
Employee
system for
assistance
employees.
program, yeah.
And that's a wonderful service. I've used it. It's really easy to access. So just talking about how Care Solace will work with EAP.
Okay.
So as a Harford County Public Schools employee, we all get 8 free therapy sessions through EAP. So maybe I'll use those 8 free sessions through EAP, and then I might use Care Solace because now I want to go out and I realize I need therapy for a longer period of time. But also it may be that, well, I realize I'm going to need therapy for a much longer time than 8 sessions, so I'm just going to start with Care Solace. But I just want to be clear that we still have EAP. It's still
Okay.
an amazing resource.
Yes.
But people may look at the benefits of each and decide which one they want to use. And I really would encourage people. I think therapy, mental health therapy is really an amazing thing to engage in. People who think therapy is not for them probably have just never tried it, to be honest with you. So,
Yeah, this is great. Well, thanks so much for joining me, and
You're
thanks
welcome.
for sharing this great resource for our families, our students, gosh, our entire community.
great, thank you.
And thank you, parents, for joining us for the Parent Academy Real Talk on Care Solace. We'll see you next time.